for pain. If they're having physical therapy or taking medication, the pain is not under control, then again, this would make them uninsurable. Insulin dependent. If your client is diabetic and is insulin dependent, they take over 50 units of insulin per day, then unfortunately they would not be insurable. If your client already cannot do one of the activities of daily living, then they would be uninsurable at that point too. Some examples of insurable conditions are cancer. You may have a client that's had cancer in the past and you think that they're uninsurable. That may not necessarily be so. Many cancers are insurable, especially if they are early stage cancer. If they've been treated and they're cancer-free, then many times we can get them coverage. Diabetes type 2. If they're type 2, the diabetes is controlled by diet and exercise, or even if low dose of insulin under 50 units per day, then we can probably get them coverage. Heart disease. If the client has had heart disease, been diagnosed, they're under treatment, everything is under control, and it's been a period of years since the diagnosis, there's been no recent hospitalizations or heart attack, then they may be insurable. Depression is another medical issue that is acceptable with long-term care, again, as long as it's under control, and they are taking 3 or less medications to keep this under control. Okay, now what I've done is doing a case study that we've chosen to help show why some clients are insurable and some are not insurable. And this is a couple that came to us recently. They both have some medical conditions that we thought they may not be insurable. We weren't sure, but we thought, you know, with their conditions it could be questionable. The husband had a history of broken bones, and he said this was from accidents, but he had broken his arm several times, broken kneecap. We were just afraid that it might come out that he had some form of osteoporosis. And yes, men can get osteoporosis, or we thought there may be some bone density issues. He had had herniated disc repair surgery a couple years ago. Again, this is an issue because it relates to musculoskeletal issues, which are very important when we're looking at long-term care insurability. But he'd had this surgery and it was successful. It had taken away the pain, but as a result of the surgery, he now has drop foot syndrome. And drop foot syndrome means that he doesn't have complete control over his foot. I mean, he's not in pain, but when he walks, the foot does drag a little bit. So we weren't, as I said, we weren't sure with these issues if he was insurable. The wife had several issues, anxiety and depression. She's currently being treated for both of these. They are under control, so we knew with those alone that they would not be an issue. She'd been diagnosed with celiac disease, and again, this is another condition that would not make her automatically uninsurable, but sometimes with celiac disease, if it has gone undiagnosed for several years, it can lead to osteoporosis or bone density issues. Several years ago, she had bunionectomy surgery and now has complex regional pain syndrome, which is ongoing. So she's receiving ongoing treatment for the pain. She's having physical therapy and still taking fairly strong pain medication. So after the couple went through underwriting, it turns out the husband was insurable, so we were able to get him coverage. And that's mainly because he'd had the disc repair surgery and it was successful, meaning it had taken away the pain. He can live